Management of CLL has seen a lot of progress in recent years, in particular in the relapsed refractory setting, where we now have lots of new targeted agents available. Specifically in the UK, we have venetoclax rituximab available for patients with relapsed CLL, and also ibrutinib therapy. And so going forward, we will see certainly combination therapies emerging, and we are running already a study. I have run a study in the UK on ibrutinib and venetoclax combination that shows really, really high rates of minimal residual disease negativity in bone marrow and peripheral blood. Whether this will lead to cure is the big question, and I think moving those novel agents into the front line and treating patients earlier with very effective therapies is certainly the right way forward in terms of aiming for cure. Now, for patients who have already gone through the path of having multiple treatments, then the options of bone marrow transplantation or other cellular therapies are still viable, and I think they are options that we need to consider in our patients. So currently, when patients are relapsing on ibrutinib and then go on to venetoclax, for example, in the sequencing, we would always consider bone marrow transplantation in patients who are transplant eligible. The role of CAR T cells in chronic lymphocytic leukemia needs to be evaluated much more carefully than has been done so far. And we need a lot more data, a lot more research, longer follow-up of patients treated with these therapies. And it's not clear to me at the moment where CAR T cells sit in the pathway of treatment. I would say that they would probably sit alongside bone marrow transplantation. Although I know that studies are ongoing where CAR T cells are being given much sooner. Does cellular therapy have a role? I think it does have a role. I personally believe, and I'm an optimist, that the role for these treatments will decrease over time as we're starting to treat patients with novel agents earlier and combination therapies as well. We start to treat those patients earlier on.